Now the next category is other specified dissociative disorder. You diagnose somebody with this kind of disorder is when the person, it causes clinically significant distress to the individual in social, occupational, and other areas of his functioning, but do not meet the full criteria for any of the disorder which we have talked about. That is dissociative identity disorder or dissociative memory disorder, amnesia disorder, or depersonalization and derealization. So these are the major dissociative disorders. उसका वो क्राइटेरिया मीट नहीं करता, लेकिन मेमोरी, कॉन्शियसनेस और ये जितनी भी उसकी मतलब ही डज हैव फीचर्स टू मीट दिस क्राइटेरिया, बट वो इतना ब्लर होता है कि उसको डिस्ट्रेस भी होता है, लेकिन फुल फ्लैज वो किसी भी डिसऑर्डर का क्राइटेरिया मीट नहीं कर पा रहा होता. So clinician choose to communicate the specific reasons that the presentation does not meet the criteria. Clinician record other specified dissociative and related disorders followed by a specific reason, e.g. dissociative trends. So when the clinician or when the person who is diagnosing or dealing with this individual specifies the reason that why and when and how it happened, then it would be diagnosed as other specified dissociative disorder. However, it doesn't meet full-fledged criteria exclusively for the disorder which we have already talked about.